We see these kind of things all the time. This patient has numerous moles. Most of them look fine. And this one I'm sure is fine and she doesn't need to worry, but we always like to make sure when you have one that has irregular borders and a variegated color, which is, real dark black here, light brown here, dark brown here. And then irregular borders. It's not very big and it's probably fine, but in this situation I like to just get a tissue biopsy where they look under a microscope, make sure everything's okay. It's a pretty simple process. I kind of pinch the skin so it hurts less, and I'm going to put some numbing medicine in. That's the only part of this that hurts at all. And people say bee sting, but it's not even as bad as a bee sting. I had a bee sting yesterday and it still hurts. Alright, wait a couple of seconds for the numbing, and I like to pinch the skin up so I only get the lesion, curve the blade, and we take a piece of the skin like that. It still leaves the dermis. This is going to heal fine, look fine. It's not deep enough if it's something significant like a melanoma in situ or dysplastic nevus. We would then have to come back and remove all of the bottom layers of skin where the origins of skin are, which is the dermis. This white tissue that has the punctate red bleeding is the dermis. This is epidermis. So if you have a skin lesion that's atypical, like a dysplastic nevus, you have to get the dermis out. That's where it started. And this is silver nitrate. It stops bleeding. It does stain it black. So I've had patients freak out that it's darker afterwards than it was before. They're worried about melanoma, but it's just that chemical. You can see how instantly it stops the bleeding. And then we just cover it with a little antibiotic ointment and a Band-Aid.